All right, guys, welcome back to W.D.Y.D. CSP. What do you do as a central sterile processor? All right, so here we are. I am assembling a tray that I demonstrated how we typically see trays getting assembled in the field. Now I'm going to demonstrate how we assemble a tray or the effects of quality on the assembly of a tray. Now, I'm being a little fake here. I'm going to be honest with you guys. I'm being a little fake with how I am doing this tray. I am a dumper. I'm not a picker, so I tried to do it. You see me try to do it, but this is how I typically assemble trays. I will gently dump my instruments out the tray. Anything that's left over. Okay, I am doing a visual inspection of my basket because the basket is a medical device. Okay, I am going to place my basket off to the side. I am removing my mat off and placing my mat over to the side here. And as you can see, I had some soil testing items in my hand. So I'm going to go ahead and sort my instruments out here, okay, because I need to do some cleaning verification here. So taking all my retractors, and this is the typical, again, sorting. So this doesn't change. Taking all my items that I can see and sorting them into groups, right, of like items or same items. Okay, the suctions put off to the side. Okay, grab all my scissors and group them together because I am not going to sort them by which one, because again, real estate is extremely important. So and this is your choice. You can sort your scissors by types already, or you can just place them in a group. Okay, all my forceps, I grab all my forceps and put them off to the side there. Okay, my stringers, get them out of the way. And those are bulk items. All right, and continue with all my little sharps. Grab all my sharps out of the way. And again, I'm being very visual. I'm grabbing items individually, not by groups, to avoid getting stuck or anything like that. So this is why I slightly dump my instruments onto the table so that I can see better. I have more space, even though it's a pile of spaghetti to many. It is very, very visual to me. I can see all my sharps. I can see anything that's out of the norm. It's against for me, this is against a white background. So it would be easier for me to see something that doesn't belong in there or any foreign matter / soils, rather than in a basket where everything is confined. I'm also trying to adhere to OSHA guidelines and standards that you should not be reaching into any container or baskets where sharps aren't visible, clearly visible. So again, some of those scissors were at the bottom, those skin hooks are on the bottom. If there was a knife handle on there or those skin hooks, they weren't really separated in a sense where I can see it. We do it for the OR, but we typically don't do it for ourselves, right? Now, all my needle drivers I group together as well. Typically, they're all gold handles, so they're very easy to separate. All right, so the first part is my sort, okay? The next part, I'm adding some quality matrices into this assembly, and one of it is soil testing. So I am testing the basket because that is a medical device, and this beautiful mat because mats are a pain point, right? If you don't clean these mats sufficiently or don't clean those mats effectively, you're going to have a huge problem. And that's typically one of those pain points. So go ahead and activate my cleaning verification test. Give it a little shake and put that off to the side right there while I do a second one. Now, why do I do two? Now, typically what I see people do when they're doing soil verification is that they'll test one instrument or maybe two. You want to pick random items and you want to do more than one soil test, because this is a lot of instruments, right? No, I'm not going to swab every single instrument, but I'm going to grab the instruments that I would typically see that has the heaviest soil in this set. So you would know that through experience and through working in decon, which instruments typically come back all the time from specific sets that are heavily soiled. And you would pick those instruments and go ahead and give them a swab. So I know the skin hooks for this set. I know some of the retractors. You definitely want to grab some of these clamps, like the Alice clamps and the Oshner's that you have in there. You want to go ahead and swab the jaw, the box locks, and just grab random instruments. You're not going to grab all of them. And again, you're not going to use one swab per instrument, because what's the actual rule? That if we come across a dirty instrument, if we come across one dirty instrument, the instrument and the set goes back to decontamination, right? So that's why I can use one swab to test multiple instruments. So again, I sorted through a couple scissors there to look for the ones that I know get utilized the most, and swabbing the commonly used part of that instrument, which is the jaw. Okay, activating this. Now I know this specific test takes 5 seconds for a reading. So I placed one in there. I'm going to go ahead and read the one. So I look for a color change, and this one has a very distinct color change, but I also remove the swab to see if there's any color change going on there. Okay, if it's nothing, I throw it in the trash, grab the next one, do the exact same thing, and everything looks good and dandy. Okay, I move on to assembling the basket, placing my rubber mat on the bottom of the tray. First thing that goes in is your indicators. Make sure so that you do not forget them. Okay, it's just best practice and good practice to do so. Okay, the next instruments that you want to inspect are these beautiful suctions. Now, I don't have a borescope at every station. My borescope is at an inspection station where I have to walk to and utilize it. And again, this is another inspection point, and another quality matrix added into tray assembly is utilizing a borescope to inspect your cannulated devices. Again, you want to have multiple size borescopes, because borescopes are not a one size fit all. So you want to have some way, form, or means to be able to test for cleanliness in your cannula. So what is your method? Flush method. Do you have a soil test where you can flush the cannula and get the results? Those are available out there as well. So whichever one, pick your poison. It's just required to use one or the other, or suggested to use one or the other. All right, now it comes time to inspecting my devices. Okay, so not only am I inspecting for cleanliness, I am function testing my instruments. And what you just witnessed me doing is called a tap test. So I am testing the ratchet function of the instrument one by one. I'm grabbing each instrument one by one, inspecting for cleanliness and inspecting for function. Okay, I'm also inspecting for any possible damage on the instruments. And again, this is, again, you don't see me spending a lot of time on each instrument, but I'm testing each instrument one by one. Now you would tap test instrumentation. So a rule I have is tap testing instruments 7.5, under 8 inches, you tap test. Over 8 inches, the tap test isn't always reliable, because the longer the shaft of the instrument, the easier the ratchet is going to spring open. And for instruments that are that long, you ratchet an instrument almost completely shut. With instruments that are small like this, they typically can go on the first ratchet, on the first level of the ratchet, so it's more feasible. It's much more feasible to test smaller instruments. Okay, each instrument one by one, guys. Okay, inspecting for cleanliness, looking for damage, and tap testing for function. And then onto the stringer it goes. Again, I'm not going by the count sheet. I am just demonstrating how some quality matrices can be added into a tray. There are actually, let me see, 1, 2, I have 3. There are 4 quality matrix added into this tray assembly. If you want to count the other one that I'm about to do, is probably like 5. So being specific with each instrument, again, handling them one by one gives you a good chance to see any kind of soil that you missed from the soil verification. Also gives you a chance to really inspect the instruments for any damage, so none of them are shadowing, which can happen when you're inspecting instruments in groups, right? Okay, each instrument one by one, and tap testing. Okay, now you notice that when I grabbed one instrument on there, I didn't do a tap test. You might be like, hey, you didn't tap test that one instrument. There's no consistency. That was actually a dandy forceps. There are no ratchets on the dandy forceps, so there is no tap test, right? You only tap test when it has a ratchet. So I was called out on that before. It's like, hey, you skipped 2 instruments there. You didn't tap test them. It's like, of course I didn't. They didn't have a ratchet. So I wouldn't tap test it, just like I wouldn't tap test a scissor, right? There's no ratchet. I do a function test for scissors. I do a sharpness test, right? That's another quality inspection in there, right? For function of the instrument. Okay, and this is what I'm doing. I'm doing function tests, right? This is quality, building quality into your sets. You'd be surprised how many, when you do a tap test, how many of your instruments will fail a tap test. Now, unfortunately, this video is unfair because I did this set earlier, and I did already take out all the instruments that failed my tap test. I believe that I left one of them in this set just for demonstration purposes. And as I made the video, I thought to myself, oh, I should have left those instruments in there to show that there are, if you're doing a conventional assembly of a tray and you're not doing a ratchet test or a tap test, there are a lot of instruments that fail the tap test. And you'd be surprised how many brand new instruments fail tap tests, the ratchet test. So you need to put those instruments out for repair and adjustment, actually, because either there's too much bend in the shaft of the instruments, or the jaws are misaligned, so they're causing too much pressure and causing the ratchet to spring open. That function of the instrument is extremely important during surgery. Okay, so got my instruments here. Now here is where the limitation of the tap test comes in at. So this instrument is 7¼ inches long. So this is where I would actually kind of like end my tap test here. Okay, so I'm gonna go ahead. So I think this one here sprung open. Wasn't that one? Let's see. And I think I demonstrated it with this instrument. Okay. Oh, so that one did spring open. I tried it there and I was like, oh, there it goes. So that one sprung open. Kick that one off to the side and then go get a replacement instrument. So for me, again, is luckily I am very familiar with this facility. I know where all these instruments are. Our tracking system is built so that if a technician doesn't know where it's at, there is a drop down that gives you the exact location of where that instrument can be found and if we have any in stock. So again, when you grab these instruments from your backup inventory, do not assume that they are clean and do not assume that they function correctly. Okay, those instruments go in and out of that backup inventory every day. So at the end of the day, if you have extra instruments, you put them away in the backup wall. New instruments that come in get cleaned and put into the backup wall. And as I just stated, even new instruments fail function tests. Some technicians don't really inspect their instruments very well before they put them into that backup wall. So make sure that there's no adhesive or anything on those instruments. All right, so onto the stringer and then into my next group. So my next group of instruments that I put on there are towel clamps. Okay, towel clamps are inspected for cleanliness and any misalignment of the jaw. You don't typically tap test towel clamps because, again, when they are utilized, they are clamped to the extreme, so all the way down the very, very end. They are less likely to fail a ratchet test. So you really don't tap test your towel clamps because the jaws don't cause any pressure when they close. Those are the instruments that you tap test, or those that require pressure onto the actual jaw. Unfortunately, I had a phone call that I had to get, so I had to pause my video and I'm resuming again, but hopefully it didn't take away from what I'm trying to show, that when you build quality into trays, there is some time that has to be added into the assembly and the production time. You're not going to be equal, okay? It's not going to be a 1-for-1. So here I am doing my needle drivers next, and you will notice if you looked at the video prior or general assembly of those instruments, that the actual inspection and testing of these needle drivers change, right? We do a light test, making sure that no light emits from the tips of the jaws of the instruments when you hold the instrument in a semi-closed position into a nice light, to make sure that you're not seeing any kind of light shine through the tips of the jaws. Okay, and then you do a ratchet test. Now these were Olsen needle drivers, so I don't know if you ever have to do a sharpness test on them. I've never conducted a sharpness test on there, or wouldn't even know how to do that, honestly. Would you do that with the orange testing material, or is there a different testing material for that, because it's used to cut suture, not tissue? So I'm interested to hear, do you do a sharpness test on the Olsen needle drivers? Hold the instruments up to the light. Again, these are the needle drivers, and do your tap test. And of course, make sure that you are checking for function. Now, this instrument was pretty stiff to me, so I am looking for the instrument lube. Again, wasted movement, okay? Every station should have lubrication. You should have all your supplies ready for the task at hand, right? You don't want to waste any movement during production. I'm going to go ahead and grab a tray liner, shake my instrument lube as I see me shake it, and then go ahead and spray my box locks, both sides, be generous with it, and then manipulate my instrument here to loosen it up a little. So that's nice and loose now. Okay, and onto the stringer it goes, right? Okay, because this is going to air dry. You don't want to wipe off. You want to wipe off the excess, but that's why I use the liner there to kind of glob it on. Use my lighted magnification to inspect those jaws. Do my little light test, right? Okay, no light emitting through the jaws of my needle drivers. And sometimes it gets a little tricky to look at that, so that's why I had to look at this one a second time. I was like, okay. And then do my tap test. Make sure that my tap test, that they are passing that function, because it's very important to be able to hold on to those needles during closure. All right. Last set here, again, a pair of Olsen needle drivers again, and looking at the tips, making sure that they're good. Doing my little tap test here, inspecting for cleanliness, checking those tungsten carbide inserts, and then tap testing. Okay, so let's see, let's test those ratchets. Okay, and if you don't know how to do a tap test, again, this video isn't really demonstrating that, But you want to grab the box lock, okay? You want to put your index finger on the back of the box lock, your thumb on the front of the box locks. Do not grab the jaws of the instruments, because then you are creating a false sense of security. You are grabbing it where it pivots, okay? So right at the box locks, and on an angle, you want to hit both rings at the same time. If you're hitting it on a slight angle, on a flat on a surface, or you're hitting one ring at a time, you are going to cause that instrument to spring open. So you want to hit both rings at the same time, and a light tap. You're not pounding it or playing the drums on your workstation. It is a light tap, typically 2 on each side, may require 3. All right, so testing our scissors here. So again, scissors that are smaller than 4.5 inches are tested on the yellow material, and orange material, you are testing those scissors that are 4.5 inches or larger. Okay, inspecting for cleanliness. Now, should I be using lighted magnification for every single instrument? I use lighted magnification when there is doubt of what I'm seeing. Okay, you're going to see some discrepancies very clearly on these instrumentation. It is when it's kind of like an iffy look that it's going to catch your eye, and you're going to be like, oh, wait a minute, something doesn't look right. Let me use the lighted magnifier to really look. You're not going to sit there and look at every single instrument under lighted magnification. Should you? There are schools of thought and trains of thought that says, yes, you should use lighted magnification to inspect every single instrument. But I'm going to tell you this as well. The more you look, the higher the magnification you look, the more you're going to find. Okay. If I was to use a 10 times magnifier compared to a 4 times magnifier, you're going to see things in there that is completely different. And the higher you go in magnification, the more you're going to see and the more you're going to doubt. It's like, okay, I see some really rough edges on the end of the scissor. Is that normal, or is that impeding the function in the long run, or what? So you have to pick your poison and be careful what you're asking for. So again, the naked eye is typically a good inspection for your instruments, unless you have bad eyes. Then you want to use lighted magnification for everything. But you definitely want to do your function testing. Make sure that those scissors cut properly, right? You're going to cut and do a slight little pull. Make sure that there's no snags there. Check for adhesive on those blades, because again, they're used to cut some bandages off of patients. That Ioban that they use to prep the skin typically gets placed onto those instruments, will go onto those instruments. And you see, I just wiped off that blade there because some of my testing material was left on that instrument. So always, when you're testing your scissors, make sure that some of that testing material don't come with the instrument. It is tricky and sneaky. It will get by you guys. Trust and believe. All right, so I'm going to go ahead and close this stringer up. I am 23 minutes into this video already, 3 minutes past what I originally was able to do with the completion of a general assembly of a tray. Okay, next I'm off onto the forceps and the smaller instruments. You will see that I have my craft style bag, put away my testing material there, put my indicator in my bag, and now I'm working with my smaller sharps here, right? So some of my instruments here, being distracted by a technician, unfortunately, but you want to stay focused. Focus on the task so that you do not miss your inspection points or compromise your productivity. Now, I am not moving at a super fast pace, nor am I moving at a very slow pace. Again, I stated this before. Typically, you want to spend about 12 seconds per instrument on inspection. Okay. More or less, if you're adding some other quality, make more if you're adding some quality inspections in there as well, such as going under magnification, extreme magnification, or microscope inspection. So you have your lighted magnification and then you have microscopes. So there are some facilities that have microscopes at the workstation. Those are great when you're dealing with microsurgeries. So those microvascular instruments, those really fine tip forceps, that's when you want to use a microscope rather than lighted magnification, because even with lighted magnification, it can be extremely hard to see some of those microvascular tips, how they aligned, or if they have teeth. Those teeth are so small and fine that it can actually be very difficult to see under 4 times magnification. Now, most of these table mounted magnifiers are 2 to 2.5 times magnification. This one actually has like a very small circle, one of those extra magnified, enhanced magnification points. That's the little circle that actually gives me 5 times magnification. So that's what I typically use to inspect my instruments, is that little circle part. But that can be really hard to kind of line up your instruments in that little focus point rather than having the whole magnifier as your inspection point. So if you can find a tabletop magnifier that gives you 4 times magnification throughout the whole lens, that's going to be your best bet. That is your that should be your go-to. This one here, unfortunately, is a 2.5 times magnifier with that little circle part. That's a 5 times magnifier. I would love to swap these out to get the 4 times or higher tabletop magnifier. And I'm not sure why they don't make them with higher than 4 times magnification. They should make 10 times ones, right? Who has them in the market? Anybody knows? But anyway, continuing on to these inspections, inspecting the tip very cautiously, making sure that the tips are aligning, that there is, looking at those teeth to make sure that they close and interlock together. Because again, if that's not happening, then that forceps is useless, right? Inspect for cleanliness, making sure that anything with a gold tip, that the tungsten carbide insert is not damaged, cracked, or chipped, because although it is one of the strongest metals out there, it is extremely brittle when it is damaged, okay? So once there's a crack in there, you should be sending them out for a repair, okay? Looking at those inserts, looking at the wear pattern to making sure that they're not worn out. Now, I seen an instrument there that was damaged, okay? There was a slight crack in there. Placed it off to the side, continue my inspection point before I go ahead and replace that instrument. Okay, so again, those tungsten carbides can be pretty tricky because you might look at it and go, oh, that's just a water stain or some kind of staining on there, or just discolorization. You have to really look at it really good. So I looked at that instrument couple times because I remembered the number, forgot the number, and then had to look at the number again. Okay, again, knowing exactly where to find this instrument because I'm familiar with this facility. So I'm going to go pick out my instrument and hopefully it's where it's supposed to be at, and that I have enough of them, because again, those things, tungsten carbide insert ones, they usually get replaced a little bit faster because, they damage, they do get damaged and they wear out, not as fast as stainless steel, but they do wear out, and sometimes that is a missed inspection point. Okay, so I was able to find my instrument there. Okay, and I'm doing the same thing. I'm inspecting this as well because again, backup instruments can be damaged, soiled, or even new instruments damaged and soiled. Okay. So that is one popcorn bag done. I'm going to go ahead and place this into, off to the side actually, and then on to my retractors here. Okay, inspecting for cleanliness, making sure that there's no damage. One instrument at a time, feeling the actual blades. Okay, I know that they're serrated, but they shouldn't be sharp. Okay. What's the next instrument I'm going to go ahead and grab here? My W.D.Y.D retractors, feeling those blades for any sharp edges or chips or kind of like little burrs in there. Looking for cleanliness. Okay, and neatly into the basket. Okay, you just don't want to throw them in there. All right, ribbon retractors go into the bag. I almost put it in the bottom of the basket. Sometimes you do. Okay, my Army Navies. Okay, place them in. Who's next here? I got my, I've already inspected my suctions, so they go in the bag. My Wheatlanders, my Wheatliner, okay? Wheat, the V, W is V in German, is Wheatliner, and there's no D in there. Okay, checking those springs, making sure that they're clean and that they're not sticking. Okay, also with those instruments, you want to look at the screws to make sure that there's no cracks emanating from the springs. And then again, specialized instruments. These are insulated forceps. You want to go ahead and use an insulation tester. Okay, attach the alligator clip to bare metal, and then utilizing the brush to check the integrity of the instrument. Okay, should be a nice single pass there. Okay, that instrument's good. Go on to the next one. And you want to be careful with these bristles sometimes. These bristles can stick you, right? Because they're kind of flared out. So that's what happened to me right there. I got stuck by that doggone bristle right there because my finger's right there at the edge. Okay, you want to go ahead and go across. That was a good instrument. Go ahead and turn your instrument off, and I will place these instruments in a separate bag with an indicator in there as well, because placing them in the set with metal as everything is moving around can damage those instruments, and you want to preserve the integrity of those forceps. All right, and that is how you build quality and the effect that quality has on your production. 10 minutes more than general assembly, but this is the end product, guys. Safe product for your patients. Peace.